can hardly believe we're in October already, and that, of course, means that we're rapidly approaching the open enrollment season for the under 65 market. You know, I think we're just tired talking about it, right? But I have a lot on the agenda today, just kind of some follow-ups and just, you know, to make you aware of some upcoming training. But just as a housekeeping item, if you're new to the PPACA webinars, we do hold them weekly. They're meant to not only be informative about any of the changes from, you know, the past week, but also to serve really as an open forum that we can all come together, ask the questions that, you know, that you're dying to know the answer to, and hopefully we can, between all of us, get the answers and help us all get better and be better prepared for what we have facing us. So without further ado, I'm going to start right in. The federally facilitated marketplace training for 2015, if you certified in 14, you should have hopefully already completed your training by the 30th of September. And the only reason they put that stipulation in is because all of the 14 certs terminated on the 30th. So if you didn't do your 15 training, which will carry you through the balance of 2014, you could have a lapse in your authorization or authority to sell on the exchange, and nobody wants that. So, you know, I've been getting a lot of questions about where to send the certs, and in my newsletter, under required licensing, it's the header that says required licensing. There is a list of the carriers, all of the carriers, and the information on what you need to do with those certs. So just be mindful of that. That newsletter is going to be going out later this afternoon. So if you've not already sent your certs to the carriers that you're appointed with, you'll want to pay special attention to that section and get that done. A lot of other questions are coming in about the notices that they keep getting and we keep getting from CMS, basically saying that Part 2 has not been done, which is, if you recall, after we did our testing and our module testing for 2014, we had to wait at least 48 hours and then log in to portal.cms.gov and create an account and create access. And that seems to be what's happening, that these notices are coming out. If you know you've done it, and it seems about 99% of the people that are getting this notice have registered on that site. But if you get the notice and you know that you have, then I would ignore it. If you don't remember if you did, then you're going to want to go to that site and make sure that you did at least create an account and log in and create access. If you have any questions about that process, please, you know, just follow up with myself or Judy, Jess, or Elise, and they can help you. There is a PowerPoint that CMS put out last year that takes you through that process. So, you know, again, reach out if you have any questions. Another thing that we're getting a lot of questions on, because these, you know, enrollment portals for 2015 are now coming out rapid fire. You know, the marketplace has, you know, really adapted. You know, the private marketplace has really adapted and created all of these IT solutions. And you know, I know that agents are very anxious to have a solution to make their lives easier. Trust me, we want a solution as well. But for all of you that are new to this webinar, we are working on a solution. We will have a solution for November 15th. We are working with EBIX, formerly Health Connect, and they are building our platform as we speak. We, behind the scenes, are coordinating the carriers' conversations directly with EBIX to get the 2015 information so that they can load it and get it ready for November 15th. But I have to tell you, a lot of carriers haven't even received their final approval yet from HHS on their product filing. So the solutions, I think, are going to work very similar between all of the platforms. But I just want to reiterate that URL will have a solution, and we actually are working on two. We have a backup plan just in case. So again, we will have a solution. It will be available to you as well, and hopefully it's going to make everyone's lives easier. So the next bullet point is about Assurant. As I mentioned last week, Assurant is coming into the marketplace this year for individual major medical on healthcare.gov and off, of course. And for those of you that have a block of Assurant business, they have decided to change the way they send out renewals. Since all individual health plans are going to be calendar year based as of 1/1/15, they recognize that getting all these renewal letters out to their agent partners as well as the insureds is going to be a big task. So what they've done is they have created a section on AssurantHealthSales.com under agent preferences called My Book. So that information is also going to be in my newsletter, but this is where you would need to sign up for email alerts to let you know that you have a renewal pending, and also so you can go into that site and grab your renewals so that you can be proactive in talking to your clients about what they can and can't do. The next bullet point is just a follow-up from last week. One of my agent partners, Lori, asked a question specifically about one of her Highmark insureds getting a call from Highmark, and she was very confused about why they would be calling and what they would be calling about. The insured was. When she called back, the number wasn't working correctly. But we did get to the bottom of it, and Highmark was making outbound calls about signing up for the wellness, their wellness, I can't even think of the word, evaluation. And they've decided that it was confusing too many consumers, so they have put an end to those outbound calls. But that was the nature of the call. So hopefully, if any of your insureds call, you can tell them that information. The next bullet point is, it says Montour and Columbia counties. Pardon me. And Geisinger is actually reaching out to us looking for agents in those counties that would be able to, that are licensed with Geisinger for the individual, of course, and certified on the SFM. But what they're asking for is some assistance in people that walk into their stores or their offices and want to enroll. So they're wanting to filter out these leads, if you will, to agents in the area. So if you're interested, shoot me an email or give me a call, and I will put you on the list so that Geisinger has you on the list to help enroll those consumers. There was a notice in this week from the court in Oklahoma, basically saying that Oklahoma agreed with the filers of the lawsuit that the federal government does not have the right or the ability to administer the advanced premium tax credits on all the states that work through the federally facilitated marketplace. The language in the law talks about state exchanges and states administering the advanced premium tax credits. So, of course, all of those opposed to the law file these lawsuits, and there are actually 3 lawsuits. 2 basically agreed with the petitioners that the government cannot administer the advanced premium tax credits in a federally facilitated marketplace, only in the state-based. And then there was, of course, one against that, saying that the federal government has every right to do that in a federally facilitated marketplace. There is another lawsuit upcoming in Indiana. So right now we have 2 upholding the petitioners, 1 against, and then 1 upcoming. So a lot of people, again, feel that this will end up in the Supreme Court's lap. Not sure what the outcome of that will be, but again, it's something to to keep in mind. It's not going to, of course, have any effect on the open enrollment that starts 11/15, but down the line it may have some bearing. Also, September 30th was the date that 300,000 people were technically going to be canceled if they did not supply the income verification or documentation that was requested from the federally facilitated marketplace. So there are about 300,000 that potentially, nationally, that could potentially have been canceled if they did not get that information in by September 30th. And then there are another 115,000 that could be canceled that were asked to provide proof of citizenship. So again, that's over 400,000 people that enrolled during 2014 that did not supply that information or had to supply the information and could potentially be terminated. If you get a call from one of those insureds, then of course that's not a qualifying event. You may want to keep them on your radar, write a short-term medical, and then of course try to get them through for 1/1/15 when open enrollment starts. Next week's webinar, is October 9th. Again, we have them every Thursday at 9:30. So October 9th, I've asked Steve Jackson from PrimePay to, say a few words. PrimePay is a strong partner of ours for their TPA and payroll benefits, but they are also launching their ERISA program. For any of you that work in the small group market or the large group market, everyone knows that the DOL put everyone on notice, basically saying that audits are going to increase, and for any employer that has employer-sponsored health and welfare benefits, not voluntary, needs to provide a summary of plan document, not the SBCs that we're used to now from healthcare.gov or from the carriers, but the summary of plan documents. So it's really a big hot topic right now, and Steve is going to talk about PrimePay's solution. Again, they're just launching it, and I've asked him to say a few words about it because I do believe that it's another point of contact and proving your value to your employer clients so that you keep them out of trouble, out of penalty, and again, really further prove your value to them. Some upcoming training I wanted to tell you about. We are having a Capital Blue Cross seminar on October 29th. It's going to be at the Colonial Golf and Tennis Club from 9 to 11. If you've not signed up for that, you may want to take a look at that. Both there was an invitation that was sent earlier this week, and the invitation is also in our newsletter. And Capital Blue Cross is going to be talking and hopefully giving us a peek at the 2015 products, but they're really going to talk about their platform for 2015, how they want to position themselves, and certainly give us pertinent information about what we'll need to know for 2015. There's also some other training, and again, all of this information is going to be in my newsletter, but Highmark Blue Shield for Central PA is having a strategy session on Monday, October 27th, and that is going to be from, there's 8 to 9, there's a trade show and breakfast, and 9 to 11:30 is a strategy session, and it's going to be at the Hershey Lodge. So again, watch for information on that, and I think it's probably something that you'll want to attend. Hopefully they'll give us a precursor or preview into their 2015 plans. Also, Cap Blue Cross is having their strategy session on November 4th from 9 to 12 at the Hershey Country Club, and then November 5th from 1 to 4 at their retail store in Lehigh Valley. They're also going to follow up with 3 webinars. So again, all of these training sessions are going to be fast and furious, and I think it's important that you at least engage yourself or try to educate yourself on the 2015 products. If you have any questions, of course, once we have the information, obviously we're definitely always here to help you. And that pretty much brings us up to the open forum, but I also wanted to, I also wanted to just let you know that if you're not currently appointed with Highmark Blue Shield, it does take some time to get through the contracting. So don't think that if you're not appointed that you can get appointed on November 1st and that you're going to be ready to sell on November 15th. If you have any interest in licensing with us or licensing with Highmark Blue Shield, go ahead and do that sooner rather than later so it can get through the system and you can be up and running for November 15th. So this time I'm going to open it up to questions, and we have a couple. Margie says, where do you get this plan summary document? This is not the SBC that carriers normally send. It is not. The SBC, the SPD, the summary of plan document, is, there are templates out there, but it's such a hot legal topic, Margie, that I would rely on a vendor. You know, there are various vendors out there. I know Task has a program. We partner with, again, we partner heavily with PrimePay, so we're excited to, you know, help support their product. But I would, you know, I would definitely go to somebody in authority that knows how to do these summary of plan documents, because it's I believe, $100 per day per employee per line of coverage if you're found to be non-compliant. And there's more information about the Distribution Administration event in Pittsburgh. I do. Dana is asking about the Pittsburgh sessions, the strategy sessions, and if I can find my paperwork, I'm happy to tell you when that is. And that is, Distribution Administration will host the fall agency strategy session on Tuesday, October 14th from 8 to noon at the Pittsburgh Marriott North in Cranberry Township, and that's specific to Highmark Blue Cross Blue Shield of Western PA. Also of note on that, Dana, they did send out letters, which I mentioned last week, about the termination of the medically underwritten programs, and it looks like some of the letters got mixed up. So there are additional letters going out this week to those policyholders. And again, this information is going to be in my newsletter, Dana, but I will forward that to you since I know you're a Western PA gal and sell in Western PA. So I'll get that to you. And Margie says, do employers know they need to have this document? Have they always had this? Well, yes. The first answer, do employers know they need to have this? No, they probably don't, but they should. And as their advisor, it's probably a good idea to at least reach out and let them know that it is required. This has been a requirement, I believe, since the late 70s. But it was just never enforced. It was enforced on the 401k side, but not on the health and welfare benefit side. The DOL did announce end of last year that they were going to increase audits and enforce this. So that's why you're seeing, you know, this sudden interest in these ERISA documents, summary of plan documents. So do they know? Probably not. Should you tell them as their consultant? Absolutely. And she is saying, Marty is asking if the fine is only if they are not compliant. Yes, absolutely. If they're compliant, then no harm, no foul. Not sure if there are any more questions coming in, but I wanted to, again, I'll give a few more minutes for any last-minute questions. But again, thank you so much for joining us every week. As we get closer to November 15th, again, it's going to be pretty intense for all of us. But again, I want to leave you with a message that we're here to help you. We have a wealth of knowledge from our many years, myself and my staff, of working in the individual market, and we're here to help you. So if I leave you with nothing else, that's what I want to leave you with. So we're going to have a solution for enrollment and quoting, and we're here to help. So let's everybody take a deep breath and enjoy these last few weeks before the mad rush to open enrollment on 11/15, and we'll get through it together as we did last year. So thank you so much, and have a great rest of the day, great rest